Top mistakes I see as a fertility doctor when people are trying to get pregnant. Hi, friends. I'm Dr. Natalie Crawford. I'm a board certified OBGYN and reproductive endocrinologist. This means that I'm a fertility doctor and I see patients all the time who are trying to get pregnant. And sometimes it just surprises me the amount of misinformation that's out there or just generalized unawareness about what to expect. And you'll even hear this from your doctors with gaslighting and dismissal. So, today I want to go over some of the top mistakes that I see patients are making when they are on their trying to conceive journey and what I recommend you do instead. Before we jump in, just a huge thanks for being here. As always, I love your support. So, please consider subscribing, sharing, liking, commenting. We get a lot of our ideas from the comments directly. So, the first mistake that I see is just blindly starting to try. I want to call this pull the goalie and try. You make that complete 180 from trying to prevent pregnancy to suddenly you're trying to conceive. And this is not the approach that I recommend. I love focusing instead on trimester zero, which, if we think about it, this is the time period before you conceive. And let's just remember your eggs and sperm form inside your body. The lifespan of sperm is about 90 days, around 72 days growing in the testes, and then 18 days to get out the ejaculatory system. And eggs are in your body your entire life. But in the 60 to 90 days prior to ovulation, they are getting closer to the surface of the ovary and they're more susceptible to the world around you. What we know is that chronic inflammation, insulin resistance, environmental toxins, they can be damaging to sperm and eggs, and specifically to the DNA that both eggs and sperm hold inside and to the function. Because sperm and egg are single cells, they're highly susceptible to the world around you. So, focusing those 3 months on lowering the amount of chronic inflammation that you have, living a healthier life, taking vitamins and antioxidants, this can really prep you for success. So, this is that preconception phase. So, in my perfect world, before you just pull the goalie and try, you have 3 months where you are getting your body ready, getting in your top shape so that you have the best egg and sperm quality that you can as you enter into your TTC journey. Number two is going to be not tracking your cycles. It's so often that people just try to get pregnant and have unprotected sex, and it works for a lot of people, but it doesn't work for everybody. What we know is that about 70% of people will get pregnant in the first 6 months of trying. But of people who do not, only around 13% will get pregnant in those next 6 months. That means that it's really important to try to optimize your time to get pregnant each opportunity. In addition to the fact that infertility is isolating, it can play mental games on you, it can be hard on your relationship, a top driver of mental distress. You want to do everything that you can. And we know clearly that timing intercourse with ovulation is going to give you the highest odds of success per cycle. Now, there's not one superior method of cycle tracking that is better than others, but what we know is that any method that uses what we call a fertility awareness sign, so either basal body temperature, ovulation predictor kits, or urinary hormone monitoring, or cervical mucus monitoring, are all going to be superior than nothing or than just app tracking. Remember that apps alone that use your cycle days, but do not use any of those physiologic signs, they are only accurately guessing ovulation about 20% of the time. That is not good enough. So, really learn one of those other methods, so BBT, OPK, or using cervical mucus, so that you can know when you're ovulating. And we know when you have intercourse the day you ovulate, you have the highest odds of success. The egg can only live for 24 hours. Sperm can theoretically live inside the body for about 5 days, but most sperm are going to live about 24 to 48 hours. So this means both the day before and the day of ovulation are going to be the top days. But also, more than that, tracking your cycle and specifically tracking ovulation is also going to give you insight into early hormone abnormalities that then can lead to earlier diagnosis. The number one that I see getting missed is a short luteal phase. The luteal phase is the time period from when you ovulate to when your next cycle starts. And just pragmatically, this is when the follicle that grew the egg ruptured with ovulation and reforms. It's now called a corpus luteum that makes progesterone. Progesterone is essential for conception. It opens and closes the implantation window. And so if your body cannot make progesterone as long as it needs, that can make it harder to get pregnant. Historically, this has been thought to be an ovary problem, but I really think it's an ovulation problem, probably from the brain, meaning the brain's not sending strong enough signals, or that corpus luteum didn't come from a good follicle, a good foundation. So ovulation induction, or trying to figure out, is it Thyroid, prolactin, hypothalamic dysfunction, what is happening in that zone can be hugely advantageous to try to help you get pregnant. So you only know how long your luteal phase is if you're tracking your ovulation specifically. And then your period should be regular and predictable. And if it's not, then please don't pass go. Go see a doctor right away. And that's number three mistake that I see is people just trying to get pregnant for up to a year before getting an evaluation. To be fair, this is standard medical advice, but it really doesn't serve you. Meaning, I see couples try over and over again. And some of the worst cases I've seen couples try, then they go see a doctor. The doctor will then say, well, you haven't been tracking your cycle, so those months don't count. And then they try longer before they get an evaluation, only to find out there's no sperm or her tubes are blocked. So the longest you should be trying before getting a fertility evaluation is 12 months if you are under age 35 and everything is perfect, meaning you ovulate regularly, you can track your cycles, you don't have any pain, you are not bleeding through your clothes, you can have intercourse, no problems with erection ejaculation, you don't have known endometriosis, PCOS, your mom didn't go into menopause early, you could try for up to a year at most. If you have any of those problems, you should go get an evaluation first. Absolutely. And everybody else, you can get a fertility evaluation anytime. It's actually really frustrating when you find out that there was a 0% chance all of those months that you were hoping and trying. So, peace of mind, get a fertility evaluation. If the worst case is that you just try naturally longer, but you feel more confident, I don't think that's so bad. And I would say the next marker would be after 6 months. If you're over age 35, we do recommend an evaluation after 6 months of trying and not longer, just because of the age related impact on fertility. But if we go back and remember, 70% of people get pregnant those first 6 months, only 13% in the next six. Why keep trying with such a low chance of success? So I love seeing patients before or when they've been trying just a little bit, but not that full 12 months. But you'll be shocked that I see patients after 2, 3, 4 years who've never had an evaluation. And then to add, if you're 40 and older, you should just get a fertility evaluation right away. Number four is not getting proactive testing. And just to be honest, I just told you how long you can try at maximum, but in my perfect world, get fertility testing first. Know that your uterus is normal. Know that your tubes are open. Know your ovarian reserve. Know your semen analysis. Why not be more proactive? In the world where infertility rates are rising, women are waiting longer to try to get pregnant, the world around you is more inflammatory. Why are you not arming yourself with all the information to make the decisions that you need? You can't make decisions on data you don't know. And then number five is going to be countering your odds of success with other toxic behaviors. Toxins always get a bad rap, and people online will say, oh, you're just using a scare tactic because I know so and so did this or did that, and they were fine. Yes, people conceive at the ends of all types of extremes. People with very low odds and very high odds. What we're talking about is an individual opportunity. And if you sit across from me and you have infertility, you're going through IVF, or you simply say, I want to have the highest odds of having a healthy baby possible, then the data is really clear. You shouldn't smoke cigarettes. You shouldn't use cannabis. You shouldn't drink alcohol. You should avoid ultra processed foods, added sugars. You need to control your exposure to endocrine disrupting chemicals and excess plastics, because it's not that one of these decisions is typically make it or break it, but the culmination of them all together increases the inflammation that you're exposed to, and that inflammation directly impacts your egg and sperm. So as we talk about in that trimester zero at the beginning of the video, decreasing inflammation where you can is important. So many people don't do that, and they just live their standard life, or they have a known toxic exposure like cannabis use that they don't modify. And then when they go through and they have recurrent pregnancy loss, which is associated with cannabis use, even if just the male partner is using it, then they're really heartbroken and devastated that they didn't know this information sooner. Arm yourself with information sooner, be in a position of power, and lead into trying to get pregnant, not making these top mistakes that I see. As always, love your questions, ask them below. You can check out the fertility formula for all of this information in details, and you can follow along on Instagram at Natalie Crawford MD, or check out the As a Woman podcast. Thank you.